Hello, my name is Andrew Kubik, and I'm a research fellow at the Catholic Healthcare Leadership Alliance. And we are here at the Fall Symposium of CHCLA at the Bush School of Business at the beautiful Catholic University of America. And at CHCLA, we are so blessed to have remarkable speakers, presenters, and attendees. And I have one of our speakers here with me today who just actually finished up a remarkable presentation, what we call the inaugural Grace Marie Turner Memorial Lecture. Fresh off of that and really reaching and impacting the attendees, I have no doubt, I know he did with me, I have Bob Moffit. Dr. Moffit is a senior research fellow at the DeVos Center for Human Flourishing at the Heritage Foundation. Bob, great to have you here.
Thank you very much. It's great to be here.
Absolutely. Yeah, thank you. And again, wonderful speech. Just really took so much from it, and I know the other attendees did as well. One of the things to say that you're the senior research fellow, it's
Sitting old.
but I would say more wisdom than age, but nevertheless, you have such tremendous experience that you bring with you to Heritage, that you bring with you to DeVos Center. Would you mind telling me a little bit about your background?
Sure. Actually, I was born and raised in Philadelphia. My father was a police detective in Philadelphia for 25 years. In fact, I come from a family of police officers. My uncle was a lieutenant in the police department. My cousin Jimmy Moffit was an undercover narcotics. Dangerous job. But anyway, so I was born and raised in Philadelphia. My grandparents were Irish immigrants who came from County Longford in Ireland in 1912. I am a product of Catholic education. I went through 8 years of primary school, and I went to Roman Catholic High School of Philadelphia, which was, at that time, was founded in 1890. It was one of the premier Catholic schools in the country. It was a magnificent institution. And I went to, spent, a wonderful 4 years at Roman, went to LaSalle University, and then later on to the University of Arizona. I've kept my connections with Philadelphia, but I've been living outside of Annapolis for many years. In 1980, 81, I joined the Reagan administration, and I became an officer in two agencies. I was the director of congressional relations for the United States Office of Personnel Management. The significance of that for healthcare is that OPM, or the Office of Personnel Management, administers the largest group health insurance in the world, which is the Federal Employee Health Benefits Program, which is a system of completely private competing health plans, which are available to roughly 8 million souls. It was an extremely successful and wonderful program, and I learned a lot about competitive health insurance markets from a government program, which was kind of paradoxical. Sure. But then, I got a promotion. President Reagan and obviously the team at the White House thought I did a good job, and they appointed me Deputy Assistant Secretary at HHS, where I had the same job, congressional relations, and it was a wonderful experience. I dealt with the leadership of the House and Senate. Tip O'Neill was, of course, the Speaker of the House in those days. He had a wonderful staff, and we got along really very well. One of Tip's advisors was Chris Matthews, who ended up on MSNBC, and Chris went to school with me when he was a couple of years ahead of me at St. Christopher's in grade school, the same neighborhood. But anyway, it was a wonderful experience. I learned a lot about healthcare at the Department of Health and Human Services. And we were involved in some pretty big fights, including a fight over the Medicare Catastrophic Act, which was passed in 1986. But it was a huge education. And I got to see how policy is really made on the Hill, and it's an experience, of course, that I can never live down. Working for Ronald Reagan, who it was one of the greatest professional experiences of my life. And when you drive to Washington every morning and you see the big, beautiful white Capitol, and you realize Ronald Reagan is president of the United States, what a feeling.
Wow.
It was great.
Wow, that is
8 years.
Remarkable story.
No, well, yeah, it was a wonderful experience, and And it prepared me for later on when the Reagan administration was over. I had the good fortune of being asked to join the Heritage Foundation as a policy analyst. And that
Sure, there's less to have you.
well, well, let's put it this way. I like to have them. They were, I think, we had a very, very good experience at Heritage throughout the 90s. We did some wonderful work, especially in the Welfare Reform Act. Heritage had a lot to do with that. We outlined a comprehensive Medicare reform that was endorsed by the majority of the National Bipartisan Commission on the Future of Medicare, that was chaired by that wonderful congressman or senator, a Democratic senator from Louisiana, Senator John Breaux. Was a truly great gentleman, and we had a wonderful experience with that, and it's been it's been a very busy period for the past 30 years. At Heritage.
Yeah, absolutely. Well, working in the administration, now working at a think tank in DC, being part of the DC culture policy, you're used to articulating your position, defending your position, being in tense situations. I am not going
especially congressional hearings when they put you under oath. Wow.
I bet.
Yeah, you go to the bathroom.
Sure. Well, I'm not going to put you on the spot because I don't want to make it too tense and ask you if you're still an Eagles fan. I will not ask that.
No, I like the Eagles. I'm a football nut,
Are you? Okay.
Yeah,
very good. Yeah. Well, remarkable background. During that time, you met and began to work with Grace Marie Turner.
Oh my.
And today, we again just so excited to have you here to give the inaugural Grace Marie Turner Memorial Lecture.
Yeah.
And I'm just wondering if you can put into some words what that means to you.
It almost takes my breath away, and I'm almost speechless talking about Grace Marie Turner. I get emotional thinking about it. She was a consummate leader. She was truly a great leader. I first encountered Grace Marie Turner during the very bitter debate that took place in 1993 over the Clinton health plan. And she was the chief organizer. She was really kind of the godmother. She was the chief organizer of the health policy community in Washington at that time that was skeptical of what President Clinton and Hillary Clinton wanted to do with the healthcare system. So we would meet, I guess, on a almost regular basis, every week or 2 weeks and so on. But she was as I say, she was a brilliant woman. She was a great leader. The thing that was absolutely remarkable about her was her diplomatic skills. I mean, when you have a group of economists and political scientists, in a room, I mean, you're dealing with cats. Everybody's got a better idea, And the thing that was remarkable about her was that she could herd cats. I mean, very few people can actually herd cats. But I mean, cats are hard to herd. But she could do it. And she did it because, it was a two things. One is her personality was very, very congenial. And of course, no matter what the disagreements were, she was always saying, well, let's talk about that a little more. And, and basically what she was able to do through her consummate diplomatic skills and her grasp of the substance of the conversations, she was able to get these cats to actually march in line on, some very basic things about how to make the healthcare system better. I dealt with her intimately in that respect. I mean, in other words, we would have these meetings, as I said, and, of course, she would always have the cookies and the coffee. But cookies were very helpful. Somebody goes off the wall, would you like another cookie? But she was very, very good that way. The other thing, though, but she was another great thing about her, though, was as a spokesman, I don't think you could ask for a better witness in a congressional hearing. She was unflappable. She was very, very polite. She was very, very respectful. And even when some of members of Congress were, as those of us who have been in front of Congress in congressional hearings could tell you, it's sometimes very tense, but she always kept her cool. She never let, never let any of this anger ever get to her. And she was always very, very measured and deliberate and very, very careful. She was, and measured and deliberate is important. You would never, let me put it this way. If you had the idea of somebody taking an extreme position, she was incapable of fitting that mold. She was always looking at, something that was always, her approach was, what is the most practical thing we can do in the circumstance we find ourselves now? That's what I remember, and it was just an absolute pleasure to deal with her.
I'm sure she is very proud of the lecture you gave today. My experience, not as extensive as yours, but when I first moved work-wise, when I first started working in DC,
Yeah.
and I started to go to different events,
Yeah.
she was one of the first people I was introduced to.
Oh, yeah.
And what I found,
Unforgettable.
oh, absolutely. What I found with her is she has the perfect name because she carried herself with such grace.
Yes.
And one of the things that meant so much is someone who was new to the city.
Yeah.
Every event I saw her at, after the first time we met, she came over to me and we chatted.
Yeah.
She always would strike up a conversation,
Yes.
and that meant so much.
Oh, yeah.
Being new to everything.
Oh,
Yeah, so I remember her fondly, and may she rest in peace. Remarkable woman.
Oh, rest in peace. My God. As I say, I remember, I was there at the funeral, of course, but I will tell you, it was very hard for a lot of us who attended that funeral. First of all, she left us too early. Brain cancer is a very, very terrible disease. And she left us too early, but I can tell you that she will never be forgotten. Certainly by the people who work with her. And I'm very, very happy that the Alliance is creating this lecture in her honor. Hopefully, you will have many, many speakers, talking about, how to improve the healthcare access to affordable care for millions of Americans, and they'll be doing it in under the auspices of her name. What a wonderful tribute, actually. What a wonderful legacy.
Absolutely,
Yeah.
absolutely. Well, and on that note, you gave so many points to consider in today's lecture. Exactly, 7 points, in fact.
Yeah.
And many. No. I don't think there could be too many
Well, there
when
were
it comes to fixing healthcare.
Well, no, the point I wanted to make is that there are dozens and dozens and dozens of things. I mean, there's so much that could be done in Medicare, Medicaid, the private health insurance markets, hospitalization, the hospital markets. My goodness, and it's, and again, I don't want to beat a dead horse to death, but we're dealing with a sector of the economy that is huge, and it's probably more complex than any other part of our economy. We're talking about 1 out of every $5 roughly is being spent on healthcare, and the complexity of it. It's, you're dealing with doctors, hospitals, clinics, home health agencies, insurance companies. You're dealing, with employers, employees. You're dealing with state and federal regulatory agencies. I mean, my goodness, it's and it's an area that every single day, no matter how long you've been studying or in the business, you learn something new every single day. I mean, it's literally that true. I mean, in other words, you'll never be able to conquer it intellectually because, first of all, it's very dynamic. And on top of that, you have all kinds of other things that are going on, like biomedical research, medical technology advancements. And we have a new Secretary of Health and Human Services, Robert Kennedy, who's opening up a new front in this thing. We didn't really talk too much about, diet and exercise and chronic illness and stuff like that as part of healthcare. The healthcare debates were always about insurance and access and affordability, but Kennedy has opened up a whole new front. And that's going to demand even more effort, intellectual effort by the policy community to get their hands around this. Everything, from vaccine policies to diet, to the food guidelines and so on, all brand new areas. Nutrition, I mean, what healthcare economist knows anything about nutrition? Probably zero, you know. So yeah, I mean, there's an awful lot there to know. And so, I mentioned 7, but there are dozens of things.
Well, I'm wondering, out of those, or out of the dozens that you did mention,
Yeah.
the theme for the Catholic Healthcare Leadership Alliance's Fall Symposium is advancing Catholic healthcare.
Yes.
If you can maybe consider one or two and discuss one or two points that you think will really effectively advance Catholic healthcare, what would you share?
Well, in the area, let me put it this way, there's so much could be said here. I mean, for daily mass will help a lot. But I would say that in the area of basically changing the battlefield over the moral and ethical questions that face the country is really critical. And that's why, I mentioned our Lord's reference, about the world. And we must be as innocent as doves, but as wise as serpents. In the area of material change, it seems to me that the most important thing we can do is empower individuals and families to control their healthcare dollars or the flow of their healthcare dollars. And that is to say, as I pointed out, I think in the speech, it's not a debate among economists, that this is a very, very strange area of the economy because individuals as consumers have very, very little power. I mean, we don't control our insurance. We don't control a lot of what is in our insurance. We don't control our benefits package. We don't control anything dealing with the cost what we're required to pay. And that doesn't exist anywhere else. So the question is, how do you empower individuals and families to control those dollars? And I suggested today, and I'll repeat the obvious, but I think we have to do two things. Number one is we have to reform the federal tax treatment of health insurance. That is to say, we have to make the federal law governing the tax treatment of health insurance fair. There should be no discrimination. There should be a level playing field. You should not simply have a system that says, well, if you get your insurance through your employer, you have unlimited tax breaks, regardless of the size of the benefits package. I mean, literally, that's what we have now. Now, I'm not saying that we spend less or the tax benefit, is reduced in any way. Absolutely not. I'm not in favor of eye shade healthcare. No. What I am saying, the green eye shade approach is wrong, but the idea is to make it fair, and that is to say that everybody should have the right, if they cannot get health insurance through the place of work, they should have, under the current law, they should have a right to have an individual tax break that is at least as generous as their employer-based tax break for them to be able to access the coverage that they need.
Yeah.
And I think that coverage should be broad. In other words, it should be anything that is approved by the federal government, federally approved plans, or state government, because health insurance markets differ from state to state in a radical way. If you're buying health insurance in Iowa, it's not like buying health insurance in Massachusetts or Hawaii or New York, right? And because the markets are radically different. We live in a federal republic. It's a very pluralistic society. And in fact, the economy is very, very different in many different parts of the country. And the cost of things differ radically from the different parts of the country. We have to respect the facts on the ground. The second thing is, and this is somebody raised it during the question and answer period, but I think it's important to reinforce it. And that is, the Catholic social teaching on this point has been clear, since Leo XIII outlined it beautifully in Rerum Novarum, and that in 1891. And that is, members of civil society, all of us as members of civil society, but also those of us who are in government, have to maintain a preferential option for the poor. In other words, there is a special consideration that must be given to those who do not have the capacity to take care of themselves. We have that duty. As members of civil society, of course, charity, we do that through charity and so on, but it is also, in terms of public policy, that is also a legitimate responsibility of the government.
Wow, very thoughtful. Yeah, thank you for that.
Well, I think it's simple, but the Catholic Church's teaching on this is clear,
It is.
and I think it's simple.
It is.
Just like the Sermon on the Mount was simple. You know, just like the Golden Rule is simple: do unto others as you would have them do unto you. I mean that's what we're dealing with here, and we're blessed to live in the greatest country in the history of civilization, but we have a lot to do to improve it, and we certainly have to do an awful lot to do to basically preserve the Judeo-Christian concept of what it means to be human.
Yeah, absolutely. Bob Moffit, Senior Research Fellow, DeVos Center for Human Flourishing, the Heritage Foundation. Thank you so much. Thank you for your lecture today. Thank you for taking a few times to talk with me.
Thank you very much. What a pleasure.
Yeah, it is. The pleasure's ours.
Okay.
I'm Andrew Kubik, again, Senior Research Fellow for the Catholic Healthcare Leadership Alliance here at the CHCLA's Fall Symposium. Thank you for joining us.